Good evening, everyone. Thank you so much for joining us once again for the PharmAssist virtual learning experience, an educational program brought to you by Mandell's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your own home. So tonight we're going to do something a little bit different. You already may notice that we have our panel here of nurses, and we are going to be discussing a topic as a group. And I really just want this to be an open conversation between all of you. And this is a great way for people to learn about what our entire group of pharmacist nurses are thinking. So tonight's topic for our inaugural program is going to be the positive outcomes on infertility treatment that we have learned throughout COVID. Now, you're probably wondering, what does that mean? Because nothing has been positive about COVID, and oh my God, we know that's not true, right? A lot of times those are the first things that come to mind. And sometimes we've got to dig for a little bit and realize the positive things that we've learned. And just like we've all learned at home and spending time and seeing friends that we maybe weren't able to through Zoom, all of that stuff also applies as regards to our fertility treatments. So tonight, what we're going to do is offer up a conversation where everyone will be able to share what they've learned at their clinic and really just hear between each of you your thoughts. So feel free to ask questions amongst each other as we go. So before we get started, I just want to do a real quick introduction. And I was going to pretend up front that I was able to read all this stuff just from memory, but no, you've all done too much, so I'm going to definitely be reading, so forgive me. But I want to introduce us all so that we all know, everyone at home knows who we're speaking about. So first on the list, I would like to introduce Dr. Karen Hammond. And Dr. Karen Hammond is a board-certified nurse practitioner and a native of Birmingham. She has her 3 degrees from the University of Alabama at Birmingham and has practiced in reproductive endocrinology and infertility for more than 35 years. So thank you for bringing all of your expertise. And we're going to be able to dig a little bit deeper into your background as we go throughout the conversation. But thank you so much and welcome, Karen. We appreciate your attendance tonight. Next, moving on to Wanda Hofkasang. Thank you so much, Wanda, for joining us. And Wanda Hofkasang is a certified healing touch practitioner, and she is a change of career nurse, having obtained her Bachelor of Science degree in Business Administration and Finance from the wonderful Montclair State University. Congratulations. After working in the business field for a few years, she decided to make a switch over and join nursing, and has now been practicing as a nurse for over 25 years, with the vast majority of those 25 years in women's health, reproductive health, and infertility at a well-respected hospital network in northern New Jersey. So thank you again, Wanda, and welcome to the program.
Thank you, Craig.
All right, moving right along, we have Caitlin Endicott. Thank you again, Caitlin, for joining us tonight. Caitlin is a nurse practitioner in Northern Virginia who specializes in third-party reproduction. I know that's not all. That's just what you shared that you wanted me to share. So I'm sure you're going to bring more of that expertise, and feel free to add anything else you want to throughout the course of the program tonight. But thank you so much, Caitlin, for joining us. And last but not least, we have Roxanne Kennedy. Thank you again for joining us as well. And just as a brief introduction, Roxanne is an IVF coordinator at Wake Forest Baptist Health and has been an IVF coordinator since 2010. And again, feel free to share more. That is what she wanted me to share, but the rest of it will come out throughout the course of the program. So thank you all, ladies, very much. Thank you for joining us and for bringing all of your expertise to everyone sitting back at home who is wondering and cannot wait to hear what you think the positives are that we have learned in infertility treatment throughout COVID. So with that being said, I would just like to throw it out to you, whoever wants to go first and maybe share some ideas. And like I said, round robin, feel free to jump off one another. I am finally, for everyone at home, going to be shutting off my camera and my voice, so you don't have to listen to me anymore. Listen to the people you came to hear, our esteemed panel. Welcome to the PharmAssist program, and enjoy, everybody.
Well, I'm sorry. I was just going to say, I guess I'll start out and just kick us off and thank Craig and the folks at Mandell's, as well as my fellow panelists for being here tonight and trying to make some sense of all this madness of COVID and what this has meant to us over about the last 18 months now. I'm a believer in rainbows and clouds having silver linings, and seeing a rainbow is a reminder that things will be okay. And I think the biggest thing that I have found that's a positive from all the COVID is the importance of working as a team. I think teamwork is dream work, as corny as that sounds. We all need each other. in a practice in fertility, we certainly have to function as a team, and everybody have a common goal and purpose. But there's been no bigger purpose than protect the health of one another and our patients, and hopefully the babies that are going to come out of our hard work and our patients' dedication and determination. So for me, the biggest thing has been the importance of teamwork and knowing that everybody has to wear a mask. Everybody has to practice social distancing. Everybody has to use good hand washing techniques. All the things that we've heard so much about on the news of late, we all have to do it. And it's not just when we're in our practices during our usual clinical time. It is all the time, because we're only as safe as our own behavior, and as hard as it is to believe, we're only as safe as the behaviors of those that we interact with. So those are that's my biggest positive, is to reinforce the need for teamwork.
I agree with you, Karen. And I think that now in the fertility community, we're getting our footing again after last year of different staffing issues here and there and people being pulled to different roles. I think we've seen a lot, and I've spoken, with different colleagues in the area with that. And that feeling of last year of having to spread yourself out of what your normal role is, and kind of what you were used to on a day-to-day, I think we've seen positive outcomes from that we're all able to pitch in different ways, because we learned to do different roles through that time. So it's a great sense of teamwork, and I think that the patients can feel it too, that there's just more people available to help them with different questions, issues, just because we've all been kind of forced to widen our horizons and learn all those different roles. So I completely agree with you on that.
I think the positive for us here in New Jersey was becoming a bit more efficient in maybe how we were working. I think we thought we were working pretty efficiently, and then we were really put to the test with COVID. So I kind of just, Karen offered so much about the teamwork, and I think that's been a challenge with telehealth and some remote working. So I'm not sure how you guys are all doing with that with your own staff, but from our end of things, the telehealth has actually been a great aspect to the practice, because I think we do a lot of consultative, we do a lot of talking and explaining terminology and helping calm fears. And that's something that it's nice to be in person, but I think that the telehealth has been really good. Our doctors have really stepped up with that. Our nurses aren't really doing that as much at the moment for their part of it. It's more still phone talk if their nurses and in the office are seeing the patients now, more that there's a little more patient contact. But I do think becoming more efficient with the adjusted way we have to work is still a work in progress. But it's been a positive, I think, that we're finding new ways to do our job, a little different, but still hopefully having a connection. And that's probably the piece that I would say is hard sometimes, is maintaining the connection with COVID. How do you connect when you're supposed to stay 6 feet apart and be on telehealth? So I don't know what you all have had for your experience with your telehealth part of it, but it's been an experience for sure.
Yeah, we moved towards telehealth probably back in March of 2020 when everything shut down. And some of the docs I work with favored it anyways. And so when that became more readily available for everyone, we just kind of leaned into it. And it turns out we actually see the most patients in our department in a telehealth setting. And we've continued to do so, mostly because we find that patients feel more comfortable not having to, there's, as you all know, every clinic's a little bit different, but once you start your fertility treatment cycle, I mean, you're in the clinic multiple times a week. And especially if you're the kind of patient who's not open with your employer and you want to try to keep things private and they don't know what's wrong with you and where you're going all the time, at least to be able to start the journey at home or in your office privately, where you don't have to explain yourself and you can have maybe your partner with you or have your partner on the phone, or, just it becomes a lot easier, I think, and valuing patients' time and understanding that it's not so easy to drop everything and come into the office. So we've actually kept it going. And there are some patients who do still want to come in for in-office visits, but I think the overwhelming majority actually are happy to continue on with their initial consults being virtually.
Do y'all think telehealth is here to stay, even beyond the pandemic?
Yes.
I think
I would say our practice, our doctors are, it feels like it's moving a lot faster with telehealth. I don't think it's not meaning that it's not efficient. I just think there's so much focus when you have that patient and you're talking like this, that I think the doctors are really able to focus, and so is the patient. Like Roxanne just said, the patient isn't thinking, oh my gosh, I took 2 hours to come here in between an early lunch hour. They're not 1 foot out the door, 1 foot in.
One of the other
Go ahead. I'm sorry.
One of the other things that, in an effort to try to value our patients' time, when they would come into the office in the past for their new patient visits, we'd say, we're going to do an ultrasound and we're going to do blood and this and that. And a lot of times they're not prepared for that. They just want to come in and talk. And we think we're doing them a favor by throwing all this other stuff at them. And I think it oftentimes can really stress people out. So I do think it's nice to kind of separate that, let the initial consult be the time to really just focus, talk through everything, and then give them time to process what the future holds for their fertility treatment cycle and come in when it's convenient for them.
Absolutely. I think we're also seeing that we're able to reach more patients that may not live as close. And so, prior to telehealth, everyone was coming in for those initial consultations. Now we're able to do those from afar. And then I don't know about you all, but I think that as a fertility community, there's more strength amongst the clinics in doing monitoring further away, closer to patients. And so we're able to provide care that we didn't before, or it's at least becoming a little more comfortable and normal. Whereas if we set something like that up prior, it may have felt like it was a lot of coordination, where now it's becoming more normalized to provide that sort of care.
Mm-hmm.
It's kind of interesting. I had not really done that much telehealth previously. Once in a while, patients that were coming from far away, I would do an initial consult via telehealth. But patients still needed to come in to get signed up or to enroll or to make further plans, to get all of the monitoring and such you were talking about, Caitlin. But now the third-party payers, at least in this part of the country and probably the rest, will cover telehealth visits just as they would an in-person visit, as long as the country is still in a state of emergency. And I can't imagine that will end before the end of the year. But I'm kind of wondering if the third-party payers, the insurance companies, are going to be willing to continue that, because it is efficient. I think patients do get a lot out of their visits because they can schedule it without the frustrations of being in traffic for a couple of hours or so to get into our practices. So they're a little bit more relaxed in a more relaxed environment.
Mm-hmm.
And I think that's helping our doctors too. I mean, sometimes they think about their day and they're running in the morning, some of them doing scans at an office, and then they might be a doctor that's, on call for that week or that day or that night, or then they're going to the OR, So I think for our doctors, I would have to say, not speaking for them, but just seeing how they even seem to appear more relaxed, doing the telehealth. It's helping maybe them as well not have to worry about, like you said, Karen, traveling and getting to the office. When you have multiple offices, usually the doc has one main hub, but at our place, they do come to one of our main offices and they rotate through that. So.
Yeah.
It also makes sense when you're looking at the idea of these telehealth, specifically in infertility, like you guys were saying, that patients come in. It's not just like, hey, I come in once every 6 months for a wellness visit, right? And I could see insurance is starting to be like, it's once in a while, like get patients back in the door because that's whatever, that's the process they like and what they're used to and whatever. But when you start looking at it from the point of view of like IVF, where you're coming in, or in the past would be coming in so frequently, it's a lot more, there's a lot more regular visits, that now we really are learning how many of those we just kind of did in person because that's the way we always did it, not because it was the best way to do it by any stretch. So that's really what's been helping when you're looking at, that streamline effect, and from a patient's point of view, feeling like you have that one-on-one you don't see the doctor the moment before they turn on the camera, and then you don't see them the moment after. But the moment that they're there, it feels like it's 100% everything is on you. And so you don't have that moment of feeling like, I hear everything that's happening, like right before the doctor walks into the room, he's talking about another patient. And, you feel kind of like maybe you're not, you're getting like 90%, not 100%. This way really feels like that, that moment of eye contact is pretty intense on a Zoom call. Even if it's kind of electronic, it can really help to streamline that connection. And then allowing, like you said, somebody to immediately hit, okay, I can hang up, and whoa, I'm going to go have a quick drink or something like that to recover from that call. Not on the doctor's side, by the way, on the patient side. But maybe go have that, hey, I want to calm down after that call. And it's a lot easier to do than when you're like, in the office and now you have to, like you said, drive an hour and a half commute to get back home or whatever that might be. So that's a great point of view when looking at all of the telehealth value and benefit that we've gotten from that. And it's good to see that it seems like that's been one of the things for everybody across the board. One thing that I was just wondering, I'd like to hear a little bit on the other side of it, when you're looking at even maybe just from the access to the patient population, is we've all kind of noticed a little bit that sticking everyone at home for an extended period of time all of a sudden makes you start to realize, maybe you think about things you weren't thinking about before. Maybe you start thinking about your long-term plan more, because you don't have the day-to-day, I'm just trying to get through Monday. And now I'm just trying to get through Tuesday. By the time the end of the week, you're like, oh my God, it's already Sunday. And now I'm just trying to get through Monday again. When you're stuck home, you start thinking about, that thing that I've wanted to do for 2 or 3 years, but I always said maybe next year, maybe I'll just do it now. So there's been a real big spike of people just exploring the interest in wanting to pursue family growth that maybe wouldn't have happened naturally had we not, had this pent-up demand that happened from it. And I was wondering everyone's thoughts on that in terms of your own personal clinics and how that's been, connecting you with patients that maybe you wouldn't have seen for another 2 or 3 years, which also then leads to, hey, their chances of getting pregnant are diminished because time is our worst enemy, right? So there's that a benefit factor on both ends of that.
Yeah, that's a good point, Craig. I definitely feel like, of course, initially when the world closed, people didn't go, couldn't really pursue. They didn't know what was going to happen and kind of put their family planning on hold. But I think a few months into that, we saw a huge upswing in patients wanting to come through and do treatment cycles, come back for frozen embryo transfers, even though their first baby was not even a year old. They're like, what else are we doing? We're home, might as well, go hard on that. So we definitely didn't see, kind of the big decline that I think a lot of people maybe predicted might happen, given the uncertainties of COVID and how it would affect pregnancy and all of that.
I think part of that, as well as a lot of patients were working from home, the majority were, so they were much more flexible to come in for treatment cycles, for those morning monitoring appointments. So that was one of the things that I heard from patients a lot was, now's a really good time for me. I'm from home. I'm super flexible. We actually had quite a few patients that were going to freeze embryos and transfer later, but hey, now's a good time. We'll move forward. And it's, one of those positives that they're like, we got our baby sooner. So it's one of those things that we have seen from the flexibility with working from home from the pandemic.
Yeah. I did notice also, we have a lot of teachers that come through, and for the most part, my summer is packed with teachers trying to do their treatment cycles because that's when they have the availability. And this year our numbers went down a lot during the summer, and we realized it's because people were able to do it during the school year, and they were actually able to have a summer, like not spend their month of July in the clinic doing an IVF cycle. They were actually able to go away and have a vacation and enjoy their summer. And so that was really nice to see that those teachers that work so hard that didn't always get to have time off when they wanted it were able to be more flexible.
So with that boom, has anybody else experienced within their clinics like expansion? Because I would say that we've expanded by adding more doctors, more offices, opened up an office actually, like Roxanne said, when everything shut down, but I'm going to say maybe June, July was a newer office that was supposed to have opened and it just had delayed, not due to COVID. And then that opened, and now we've got a couple new docs and then a couple new offices. So there definitely like is expansion within. And I think that's just, as Craig kind of is pointing, I think it's people are deciding they're not holding off and they want to just do this now and let's do it. And I think we've seen a fair amount of healthcare providers, lots of nurses and lots of doctors and that type of client coming in as well for our environment and our.
I think a lot of that, from my perspective, is that all people, our patients, ourselves, we've realized the importance of the sanctity of life and what really is important to us at the end of the day. And so for some patients who've waited and they thought maybe I'll do this one day, and if I'm not pregnant on my own by this age, then I'll come in, and then that age gets pushed back a year after year. They're saying, life is short. I'm around family now. I'm around friends. What's missing? It may not be going to work every day. That may not be consuming them like it had been. And I think their desires for family are improved. I know my desires to be around my family, even though I love my family and I try to spend as much time with them as I can, that's just been heightened, especially when we were separated during the pandemic. So I think it helps. This has helped to put into perspective what's really important and what their true goals are at the end of the day.
Yep.
I just like to bring up another point, if I can. One of the things that I have always tried to do is to talk to patients on their level. Anybody I'm talking to, I try to meet them where they are in their journey and their background and their education and their understanding. But it's been a little bit of a challenge to meet people where they are with respect to what it means to have COVID or what it means to be vaccinated. I know this is a tough thing to talk about, but one of the questions that my medical assistants ask every patient when they are bringing them back to see me, or even scheduling for a telehealth, is, have you been vaccinated? Has your partner been vaccinated? And we get some pretty hard no's, and not only no, I haven't, but I will never do that. One, because they don't believe in it, they don't think it's right. But more commonly because they're afraid of what this may do to their fertility or to a pregnancy. I think the data are pretty clear from what we've learned in these last 18 months, albeit not very long, that people should get the COVID vaccine, that it doesn't matter if you're trying to get pregnant. It's equally important, and sometimes I think more important, when people are contemplating pregnancy. It's going to be a while before a vaccine's available for really young children. And so the protective antibodies would be passed along to babies in utero, and if they're breastfeeding and maybe beyond. There was just a paper that came out this past weekend from Human Reproduction showing that there's no impact of ovarian reserve after taking the COVID vaccine. But I still have patients every day that are afraid to take the vaccine or are adamantly opposed to it. I'd be interested to know how y'all have dealt with that and how deep you delve into asking patients if they are vaccinated and understanding why if they have not been.
Yeah, I think from my perspective personally, it's been, talk about evidence-based medicine. This has been the last 18 months for it. So it's really staying up to date with the latest data and phrasing it in a way that is well understood by patients. I think that's the other piece of the puzzle, is that there's a lot of articles and things that aren't based on data. And so separating the two and providing that information in a way that can be understood and comprehended at the level that it needs to be to make those important health decisions has definitely been, I think, a challenge. We are asking every patient if they've been vaccinated, when they were vaccinated, what vaccine they got, if they're not, why, and really diving into those conversations, because it's very important in the risk of contracting COVID in pregnancy versus the vaccine. It's so much higher risk there. So that's usually where the point of view that we try to come from is that huge risk. And with me, third-party reproduction with gestational carriers and egg donors, that's one of the very first things I ask them. A lot of them are not local, and so traveling on airplanes and things like that. And if they were to test positive, what that means for the cycle, there's just a lot of weight with that too.
Mm-hmm. Yeah, we do the same, because I'm at a clinic that partners, it's, an academic clinic, and we partner with the hospital. We have to follow a lot of their guidance for how to manage surgeries and procedures and things like that. So everybody has to be tested. And it was a little different for us in that it's actually not helpful to be tested 2 days before your egg retrieval, because guess what? We're actually going to egg retrieval if you have 40 eggs and you test positive. Like we can't just leave you high and dry. So we've been actually testing patients before they start their injection treatment cycle, and then asking them to really not so much quarantine where they don't leave their house, but just to make sure that they're wearing masks and adhering to all the behaviors, even if they are vaccinated, which I think is different, coming into the latter half of the year than it was in the spring and the summer. We all felt a little bit freer. So, but one thing I have noticed is that there's the patients who will definitely get it, the vaccine, no question. There's the patients who will definitely not get the vaccine, no questions. And then there's those that just need a little bit of reassurance, and they've seen something on Facebook or wherever that talked, so-and-so's cousin twice removed told them that they, couldn't get pregnant after they had the COVID vaccine. And they're just looking for guidance from us, and to make sure that, we trust the science, and we don't want to put them in harm's way, and we want to do everything we can to protect them and help them on this journey. And I found that those patients are receptive when we can show them the data, and we can, use other patient examples and let them know that, the doctors do feel strongly that we want to protect you, and this is in your best interest. And so I think we've been able to sway some people, which has been helpful. See humanity that way.
It's just keeping them informed. I think our website, of course, has something, as I'm sure all of viewers do as well. Like a very first, when you open it up, there's something there that they have them click on. In terms of us, sort of like you, Roxanne, we're affiliated with a hospital. So where our OR is, we were required with COVID to make sure people were tested, which was a little crazy for the retrievals, and it had to be within a certain 5 to 6 day time period. And so a lot of that was hard, using a third party person that was, doing our test for us at that time. So we've kind of come a little bit away from that, and we're doing our own in-house testing now for the patients. But I think even more important too is if you guys are how you're dealing with your employees, because I know we just had something come up with October 1, people have to be vaccinated because we are in a hospital. So, but there is religious and medical waivers to that as well. But we still do have some people that aren't vaccinated, and they have their reasons. So it might be if they're not going to sign a waiver for that reason, I don't know, but that just recently came to be. So it's just trying to be promoting for our patients what's best and give them the information. Vaccine cards are uploaded in the patient's chart right now, because sometimes when the OR sometimes loses the COVID result or whatever it is, so we need to show vaccine and all that. So it's been a Megillah. That's been a big time. It's definitely evolved over a year, but it's gotten a lot better, but it's still a part of us. It's still what we're dealing with today. But I would say I see a lot more of our patients vaccinated. Absolutely.
So Wanda, do you ask for employees to give a copy of their card?
We're collecting them right now. If you've been vaccinated, it's on file. Dr. Chen's a big proponent of helping our practice get the word out. She does Instagram live events through our practice on Tuesdays. She's part of St. Barnabas Hospital's. I guess she was one of the first probably even providers that got one in our hospital. So she's been really doing some sort of antibody study. So she's really been the one to kind of spearhead us getting our information and all being cohesive in how we talk to the patients and what we provide them for information, just so that we're all not giving our own little spiel, but we're really staying cohesive with that. Because I think if they hear it pretty consistently from everyone, then there's no question like, oh, well, this nurse said that and that nurse said this. And that's what we want to avoid, especially where we're talking to them over the phone and such, and we might not see them as much at this point.
Yeah.
We're not asking patients for their card per se. We're just asking them to tell us if they have been vaccinated and whether it's partially or fully. And for our employees, what I've done, actually my husband, who's my partner in life and at work, he wrote a little form that's an attestation where the employees attest that they've had the vaccine or not, and when their most recent vaccine was, just because we didn't know if that was appropriate to have medical records in a personnel file. It's probably not. So that's why we've not asked for vaccine cards from employees or for patients. I can kind of see it going either way for patients. It is a tall order, though, to try to explain to patients why it's so important. And I don't know about in other parts of the country, but we have seen so many patients whose OBGYN has told them, no, hold off until after you're out of the first trimester. You're trying to get pregnant, don't get the vaccine now.
Yeah.
I put all kind of posts on Facebook and Instagram. Please do this. Here's the most current FDA and CDC and ASRM and LMNOP, QRST recommendations for making sure that you get vaccinated whenever you're ready. The only thing that says maybe you should hold off is ASRM, the COVID task force recommendations say maybe you shouldn't get it within 3 to 5 days of your retrieval or transfer, just in case you get a fever. It's not attributable to the COVID vaccine versus to the retrieval or transfer. But I think it's incumbent upon all of us to be open and honest and really encourage patients, urge them is the word that I put in the EMR, is to urge patients to be vaccinated. That is protecting them, people they care about, and hopefully their pregnancy.
Well, and one thing too that everybody touched on while we were going through that conversation about, it really is a big part of that is education, right? Is getting information to patients, whether it, like you said, whether it's Facebook or on your own individual clinic websites, or we obviously on our website try to provide education. And I'd be remiss not to say this program itself is the entire purpose of this, is to provide information so that people can learn what's out there in a way that to kind of quote what you said earlier, Karen, to kind of meet people where they are. And so we've learned that one of the greatest things that has come out of this, and I'd like to hear if you guys are seeing some of the same thing, is the ability to educate people through digital means, through virtual means, all these different places where we're not really, there's not the same level of requirement of expectation for a patient to like, hey, here's a handbook, go read this, like, in your downtime. But it's a lot easier to say, click this button and watch this video, or, listen to this little talk, or anything like that, to educate people on their own time and on their own schedule. And so obviously it's been a big benefit. We've seen that just being able to connect with our patients at the pharmacy. And I'd just be interested to hear how you guys may have learned from, adjusted to, change your process of education throughout all of this, maybe moved it a little bit more into a digital realm, or if not, maybe it's just me and I'm crazy. But I was just wondering what you guys were thinking.
I think Roxanne kind of hit the nail on the head when she said earlier that people are either going to get the vaccine or they're not, and they're pretty emphatic and have made their decision. And there's just a little handful of people that really just don't understand or are still gathering information. It's those people that we want to really target the most. But I am just as willing to target those people and just as motivated to target the people that are emphatic that they never want to do it. So as I said earlier, I'll post things on my Facebook page or Instagram for my practice. And it's kind of interesting. We get a fair amount of traffic on our social media pages. And the thing that gets the fewest likes is when I put something up about COVID. People just gloss right over, think, oh, great, another COVID post. I'm going to gloss on past that and go look at the picture of the cute baby or the new art in the waiting room. So it is a tall order trying to figure out how to make believers out of people. I think COVID almost has to touch somebody's life personally. If they're not going for the science, it really has to touch their life personally, and unfortunately for them to really get the message.
Mm-hmm. Yeah, I agree with that. And just touching back on what Craig had wondered about, staying digital and where we're disseminating information and things like that. And one of the first things I did when our clinic, which did shut down for about 4 weeks initially, was to make virtual PowerPoint slides and links and fully explaining the class that I would do twice weekly for our IVF patients, teaching them how to use their injections and all of that. And so far it's been great. I mean, when I started doing this in 2010, patients would beg to not have to come to a teach class. They were like, please don't make me come in here and do this. And we would make everybody come in. It was like you had to watch them inject, liquid into fake skin in order to know that they were going to be able to figure this out on their own. And one of the things that we've learned is that patients all learn differently. I do probably have a handful of patients every now and again who really just don't get it. And they really just need me to sit with them and do it with them. And I'm happy to do that. But the majority of patients love being able to access materials online, at home, whenever they have 5 minutes to really sit down and look at those videos and read the information, and then think about their questions and formulate their thoughts and come back with things that they really don't understand. And one of the other things that was huge is being able to direct patients where English is not their first language to be able to watch video demonstrations of medications in their language, which I cannot speak Mandarin. So it's helpful to be able to have a place to direct those patients and not make them feel uncomfortable in the clinic in a setting where I'm talking fast and they don't know what's going on. And so that's one thing that I think is here to stay. But I'm curious to know what you all have done in your clinics for medication teaches, which is, the biggest stressor for these patients is like, how do I do these in shots?
I had a very similar experience as you, Roxanne, where the pandemic, kind of was full hit. We shut down for a couple weeks and I'm brainstorming, how do I get our IVF class virtual? How do I do this? I recorded a whole PowerPoint voiceover, and the file's too big. I can't do anything with it. And I'm not a tech guru, so we're like, what are we gonna do? And not long after that, the Mandell's program kicked off, which was fantastic. We, at the time, had kind of put together all different materials and resources that we could find. We were finding we were getting a lot of questions, which was anticipated, but since we've actually been able to develop a whole schedule for live classes that patients can Zoom into for all of our locations. So it kind of streamlined everything. It made it virtual, and it's a sign-in system that they can get to a link, see all the class schedules, sign up for something that works best with their schedule. And similar to what you were saying, I had so many patients that wouldn't want to come into class because it was during the business day, most of them. So it was a big barrier for their work. And so we've had a lot of positive feedback. It gives them time to really process the class. And then we'll get a message with, okay, I took the IVF class. Here's some questions I still have. And so it's all condensed. We can review everything again, address those questions, and kind of bring everything full circle. And we're finding that patients are understanding the process much better and feeling much more confident prior to starting. So I think that will definitely stay, that streamlined virtual option.
Yeah.
Yeah, we had gone, let's see, because when I started, I was the teacher in person for all the classes in '09, and then I did a video for them that we went live, I think in like 2012, 2013 with our own website. I think back then we were pushing more with Freedom Med Teach. I'll throw that out there just because I'm sure some people know that. But the other thing that we do a lot of is Engaged MD, which is patient education and the consents for the fertility. So a lot of our modules for that, I think just in terms of cycle modules, might be tailored for your practice, because I know they can do that. And honestly, the virtual learning experience has been one of the things that I know I just really tell everybody. It doesn't have to be that they watch, and I've shared that with our nurses, because they're always like, what is that again? Even though Craig sends his lovely emails, I'm like, guys, come on, look at those emails. But everybody forgets. So as long as they have the link, then they can just really, remember to include that in portal instructions that you give to patients now, through the portal. And that's what I do every time I start a cycle. It's like I go through everything still a little bit, answer questions while I'm talking to them. And then I say, I'm sending you this great link, really go on it. You can find your 2 medications there. And it's with a nurse that's fertility, that's practicing, that kind of knows what questions you're going to ask. So that's been, I think, the great thing about the videos through the virtual learning experience here through Mandell's has really been an impact, I think, for even our nurses. They're like, wow, I didn't realize there was so much on there that you guys were doing. So that's great.
Yeah.
So it sounds like the biggest takeaway is definitely that my emails are amazing, and they let everyone know about this incredible program that you're watching right here tonight, the virtual learning experience.
They just get buried, it's hard. It's nothing personal.
Hey, it's a long time coming. It's fine. I was waiting. I was like, eventually I'm going to get hit for the email. I knew it was coming at some point tonight. I should have just wrapped this up like 8 minutes ago. It would have been fine. So I do appreciate it. Like, so far, we've really touched on a lot of amazing different topics that I think are, sometimes it's very, I was going to say it's very positive, but it's a great feeling to hear about some of the positive things that can come out from a time that feels a little bit rough while you're going through it. And I think that's a real big focus of everything we try to do here at the PharmAssist program, is to say, we understand that you might be going through a potentially difficult situation, or something that feels difficult on the outset, but really having people here to be able to provide support, to demystify a lot of these things that feel a little overwhelming. And we all know COVID can feel incredibly overwhelming sometimes. So when you can take away some of that negativity and really be able to focus on the positive aspects of the things that we've learned and how we've really learned how to be closer together. I mean, turn on the TV for more than 5 minutes, especially probably back about 6 months ago. Every commercial was just about like, look that we actually like talk to our families now again, and look that we actually communicate with friends that we haven't seen in forever. So we need that. We realize that what we needed is that support of let's dig through some of the upper layer stuff that's easy to pick on and easy to be negative about, and find the positivity. And that's, I really feel today, all 4 of you have done such a wonderful job in sharing what you've learned throughout this entire process, throughout COVID, and ways that you've been able to improve your interactions with patients, improve the interactions that you have just in general across the board within the industry, and really help to demystify, like I said, a thing that can feel overwhelming is really not as overwhelming as we think day to day. So I know we're coming up towards the end of our time, but I do not want to cut you off. If anyone else had anything else you want to say, we by all means feel free. But I did just want to give everyone maybe one last chance if there was anything else you wanted to share, and then give a chance just to say anything about anything that you've learned tonight, or any little feedback amongst each other, or anything like that, and then we can start wrapping it up for the night.
Perfect. Well, I'll kick it off and just say, I think, for me, it's been a kind of a compilation of all the things that we've talked about. I think we have learned teamwork, and as Caitlin said earlier, it's teamwork in a little bit different way, because at the height of the pandemic, we were taking on more responsibilities, and we were trying to minimize the number of employees that were coming in. So we learned to multitask, even when we thought we were already good at it. Dang, if we can't get better. And so I think we've learned so much through this pandemic, and we'll continue to learn, because as sad as it is, we are so not over it yet. And I don't think we're being optimistic, maybe 6 to 12 months we're still going to have of this. but I think teamwork, being willing to change the way we do things and to adapt as best we can. And I think that the last thing is teamwork with our colleagues. It's been wonderful to be able to reach out to some of my colleagues in the field and say, how have you handled this? And others reach out to me. We're all in this for our patients. And I think that's more pronounced now than ever.
That was a good wrap up.
That was perfect. That was,
You did a good job.
you did. You really said what
I second that.
The mic drop.
Exactly. Thank you so much. And for real, I mean, first off, as always, as we get to the end of any of our PharmAssist virtual learning experience programs, I just want to go around and say thank you so much, Caitlin. Thank you, Karen. Thank you, Wanda. Thank you, Roxanne, for all the expertise and information that you provided for us tonight. And sometimes really just sharing that, we're not all alone in our thoughts about this is really great to see, 4 nurses from different clinics all around the entire country that functionally a lot of the things that we're saying are just like slightly different off from one another. So we're realizing that these positive things really do, they cascade outward for all of us wherever we are around the country. Mm-hmm. So I just want to say thank you to all 4 of you for joining us tonight. Thank you to everyone who's watching this program at home. As always, the PharmAssist Virtual Learning Experience Program is a program that we at Mandell's try to put together so we can have engaging conversations about topics that might be interesting to you. So if you're watching this on Facebook, we'd love, please feel free, go if you have any questions or comments for any of our panelists tonight, feel free to post right on Facebook, and we will certainly pass those questions on and get an answer back for you, whether it's on Facebook, on a future talk, or every possible way in between. We'll make sure we get that back to you. And with that being said, this is our first nurse panel program. And I just want to say you guys did an amazing job. So thank you so much for giving up your time tonight to be able to be here to answer my questions, because these are not just like stock questions. I really just wanted to know answers. Like I needed answers about all this stuff, just like everyone at home. So thank you, ladies, for everything tonight. Thank you, everyone at home, for checking us out tonight. We do look forward to seeing you. We are every Monday night at 7 p.m. We do our medication educational programs, and that's 7 p.m. Eastern. And so you can check us out there as well. All of these videos, you can find them on everywhere where we are found. So on our YouTube page, on our Facebook page, you can find them on our mymandellspharmacy.com page. Everything is there for you to interact with and watch at your leisure. And by all means, feel free to post any topics that you'd like to see in our next nursing panel. So with that said, everyone have a wonderful night. Thank you, ladies. Thanks for joining us. And we will see you next time
Good
on
night,
the
everybody.
PharmAssist Virtual Learning Experience Program. Bye, everybody.